Hello and welcome to Reach Live. Thank you for joining us. Reach Live comes on the last Friday of every month. My name is Reena Sooch. I'm the head of digital and connected health at Ipsos. Ipsos are a global market research and insight agency. And today's guest and today's topic is one that I'm absolutely thrilled about because it's about research and insight. And it's a study that I personally worked on. So I have a personal interest in this chat myself. So I'd like to welcome Dr. Thomas Erlinger, who I'll be calling Tate throughout the conversation today. So hi, Tate. Welcome. Welcome to Reach Live.
Hi, Reena. Thank you. Pleasure to be here.
So to kick us off, I'd like an introduction to you. Introduce yourself, your role, and a little bit about your journey, because I think it'd be interesting for people to know your background before we get into some of the findings of this report.
Sure. Happy to be here. Thanks for having me. I've had an unusual journey through healthcare, I would say, but it's been fortuitous. So I'm a physician by training, internal medicine by background, and went into medicine with the intention of really being a primary care physician very early on. And during my residency training, I realized I was exposed to clinical outcomes research and very attracted to analytics. Didn't realize I had that interest until I was exposed. So I completed a research fellowship at Johns Hopkins and my master's of public health there, but also went on to, for the first part of my career, be in academic medicine and doing clinical research. I slowly transitioned out of academics and have had different roles working in partnership with academics, but more on the provider side. So I've had different roles in informatics, healthcare analytics, and even public health. So I was the state epidemiologist for Texas, but also have worked in different kinds of provider type organizations, so accountable care organizations, hospital systems, doing analytics. And part of the reason I think I ended up having a career in clinical analytics is because at the same time, the healthcare was transitioning from a paper-based system to a digital system. And because of that, information that was not previously available became available. And there was a large amount of interest in trying to understand, more specifically, quality, outcomes, and gain different insights. And so, as it happened, I just happened to have a skill set that was transitioning along with the industry.
That's fantastic. A clinician who is married with analytics is something which has been rare. You talked about the transition from paper to digital, and of course the electronic medical record was a huge part of that and remains to be. And now we're going from digital to digital ecosystem, right? So there's so much more happening inside the hospital and practice setting and also outside. And we're going to get into that in a little bit more detail. But talk to me about analytics, because I know a lot of the people that are watching live or also on demand have a role within trying to help synthesize data and make it more easy to digest. There's a lot of people that also generate and collect data. So I think they'll be really keen to hear from you. What has been the evolution in analytics that you've seen in your tenure, and also what do you see coming?
Yeah, so traditionally in healthcare, the most accessible information in a structured digital way was really billing information, was really information that was used for reimbursement. And so it was a form of, so that's a form of coding of diagnoses, but it was not specific to was not particularly helpful when it came to understanding quality of care or the nuances of care. Let me put it that way. But because that information was available, that was the information that was accessible for analytics. A lot of the foundation of what we measure for quality, for example, is based on those legacy structures, meaning ICD-10 codes or DRGs or combinations of them. So a lot of the quality foundation that we use to define good or poor outcomes really comes from those legacy systems. And what's changed is there's far more information available about the nuances or the detail of what's happening in a clinical scenario with the evolution of electronic health records, but also with the evolution of other applications that kind of sit around the electronic health record. And so what that means is we have a lens into the paper chart, whereas to get at information inside the old paper chart, we would have to stop and do audits and do data abstractions, and you would have to sample things. And so there's been, so it's an enormous amount of potential data locked inside these new systems, basically.
I suppose handling of that data is really the challenge at hand, and it brings us nicely on to discussing some of the findings that we have from the report that has just been released by Elsevier Health, as it's now branded. So to give everybody some background who's listening to this today, and we will be sending out the link to this report at some point during the talk, and also you'll see it flash up. So this particular study has been conducted with clinicians, so across specialty and around the world, and among nurses. So when we say clinician, we are including nurse practitioners in this too. The study design, commissioned by Elsevier, partnered with Ipsos, looked at doing expert interviews. So we spoke to key opinion leaders, individuals who have, much like Tate, years of experience in the field and have been at the front line of it and have embraced tech. We spoke to around 23 global leaders on the topic of the future and what's coming. We then ran a quantitative survey, so 15 minutes among almost 3,000 clinicians from around the world, assessing from them what they see as the drivers and barriers to tomorrow. What do they feel about the career that they have? How do they feel today in terms of taking on all this new skills? And what does the skills of tomorrow look like? So there's a lot to get through in that data set. And then we finalized this three-pronged approach by doing some roundtable discussions. So taking the findings from the first two phases and discussing them in a roundtable format in UK, USA, and China, which were the three core markets. But it was a global study, but we focused in on those three in terms of implications and next steps. You must check out the report to really get the detail. But Tate, I'll come to you because you've had a view of the findings. You've been part of the discussions as being part of Elsevier. What stood out for you when you had the first debrief and you heard about the results? What were some of the things that stood out?
Well, I think the thing that probably grabbed me initially, and the context, of course, of COVID can't be ignored here, is the physician or clinician, nursing, et cetera, burnout rates. And this was an issue before COVID. There's no doubt about it. These were things that were being discussed in healthcare prior to COVID. But the degree of turnover occurring is certainly a call to action in both physicians and nursing. It's having an impact on a downstream impact on financial viability because of recruitment and retention problems. And I think that's probably one of the most immediate things that sort of stood out to me. there are some other things that were present in the report that, again, were present before this survey. And in many ways, this survey does reflect trends that were happening in the industry before COVID. But they certainly took on a new interpretation for me within the pandemic. And that is basically what is the role of technology, but what is the role of the relationship that can occur between a physician or a nurse or a practitioner and a patient. And some of the frustration there, which is expressed in terms of either empathy or time spent, and the role of technology in that relationship.
Yeah, absolutely. I think it was approximately a third of clinicians that we surveyed felt that their work was appreciated by government, which I found interesting. And almost a third were considering to leave their current role within 2-3 years. That's not to say a third were all off doing something different. Some were retirement, some were natural transition to something else. But there certainly is a proportion of people that were just feeling like, is this for me? You know, and that's pretty stark, right? I mean, to feel that way.
It's a pretty alarming finding, and I think this is multifactorial. I think this, this is a long-standing evolution of different factors impacting the healthcare industry, and they range from not just the transition of the workflow, like complicated hospital workflows from paper to digital, which is not an easy transition to make. This is not so much just a personal comfort with technology, but it's the way you go about your day. And in health and inside a hospital, there are so many things happening and so many interactions happening. On a personal level, just on the care provider side, just communicating with each other, that when you introduce technologies where you fundamentally change the way in which that communication was happening, it'll result in both positive and some frustrating moments. But yeah, I think when you have that happening in conjunction with an increase in measuring quality, which requires, there's probably a feeling in the background, at least in some of my colleagues that I still practice with, of, feeling that they're being monitored quite a bit. So it's not just a workflow issue; it's a feeling of kind of loss of autonomy, loss of time with the patient, and many, of course, got into healthcare to have those relationships, and they feel that time that you have with patients is decreasing, and I think that creates some frustration.
Absolutely. I remember the initial interviews we did, and we looked at motivation first. It was like, what brought you in to become a clinician? And hands down, every individual, it was to help people. It's that part of it. It's the delivering something that can save a life and, change the course of someone's quality of life. Digital holds a lot of promise to help clinicians find that autonomy and that time back, right? So I think we're on a journey right now, and it's feeling difficult and it's feeling overwhelming. That comes across in the data that we have. But the rise of digital is here, and it's being seen and felt by clinicians from around the world. Almost 9 in 10, so pretty much majority of people that we surveyed, said that being technologically savvy is incredibly important now in a clinician's role. So if you do not embrace tech, then I don't know if a clinician in the future will really exist, because you need to have technology literacy as a part of your DNA. The other thing was that tech literacy is only going to grow as an important skill set. And that comes out really strong in the findings. So what was some of your view around tech literacy And how far does a doctor need to be digitally savvy? Because I think that's a question that a lot of people debate.
Yeah. I think early in the EHR evolution, so when EHRs were first coming out, and I remember when we were doing this at Hopkins in the 90s, and they were quite simplistic. I could get labs and I could make a note. It was basically almost like a contained word processor, except I could also look up labs. And those have grown more and more complex. And the tech literacy that is needed is certainly different now than it was at the beginning of EHRs. And so, and I'm only talking about EHRs here. There's other forms of technology. There's robotic surgeries and other kinds of technology, which of course is coming into healthcare all of the time. And so I think, but when we're talking about electronic health records or software, type of things coming into the workforce, I think it's critically important for physicians to understand how this technology works, what it can do, what it can't do, but more importantly, how to optimize its use in that moment, right? In the moment of care delivery. And in some ways, that means running into a lot of current limitations, right? Where we want to be able to give a voice dictation and perhaps have natural language processing or voice recognition, sort of take that on. And there's certainly advances there that weren't there before, but we're not quite at the point where you can untether from typing or clicking. Although the vision might be eventually to untether clinicians from a desktop or a laptop or a device, we're not quite there yet. And so I feel like we're in this point where technology is going to be critical for clinicians to understand, and they do have to understand how to navigate through them and how to optimize it for their particular situation, for their particular clinic flow.
Yeah, I think that the need for it is absolutely clear. I suppose it's the how, right? And the training aspect comes in really strong here. So the need to overhaul, and this is the language of the survey, we asked the question, one of the attitudinal questions was, do you feel the training of clinicians needs to be overhauled? And a very high proportion agreed. And as part of the activation of this study, we also spoke to some upcoming med students. So we had a roundtable with one, actually my favorite, with youngsters coming up in the field. And it was so interesting to listen to them to say, like, we get it, right? We know digital's here. They're very tech savvy. They're a smartphone first generation. And today their training is being done by a very senior clinician who is fantastic in their field, but they're not necessarily hearing about the digital element of their job role. And they're not necessarily even seeing it. So if the attending that they're shadowing or they're working with isn't choosing to embrace tech or isn't used to doing it, therefore they have workarounds like, I'm going to do this the normal way I did on paper, and then someone else is going to implement it once I've written it down. These, again, are not teachable moments for that clinician to step up and learn. So what do we do about training? What's your view on that?
I think training always has to start early on. So the medical students, even pre-med. So I happen to work in a volunteer capacity in my clinic, which I've done for many years, and I work with a lot of undergraduates, and we're exposing them in early ways to healthcare technology. These are undergraduates who are pre-med, by and large, or pre-nursing, and so I think early exposure, as early as possible. There are examples in undergraduate universities of informatics and healthcare informatics in general, which includes user and usability and kind of training occurring early in pre-med with laboratories and so forth. So one thought is to start, very early, and to carry that through the education. So we spend a lot of time on basic science education, some of which is really important to understand later things. But the question is, where does what I would call clinical informatics, applied informatics occur? And what I mean by that term is how to integrate a technology or a software into your daily workflow. And the way that we would do that in healthcare typically is when there's new changes to an electronic health record functionality, or there's a new software that's brought into a system, is we would do what's called at the elbow support, meaning we are there, or a team is there when you show up to work and walking around the clinic or the hallways of the hospital, helping users in the moment, because that is clearly where most learning occurs. It is in the moment when you're trying to do something. But those kind of services are not available to all hospital systems. I mean, it takes some investment to do that. So it's important, I think, that there be a recognition that this kind of training is needed early on, but also all the way out to and continuing while you're working, while you're going about your day, because these systems aren't static. These changes aren't finished changing. So there has to be almost a continual learning environment, all the way from undergraduate through to practicing clinicians who are still experiencing change after change after change. And we need to really think hard about that system. How do we make it affordable? How do we make education? How do we make at the elbow support, virtual, maybe AI driven, so that you can extend technologies and deploy them and scale them. That's what's incredibly difficult in healthcare, is I can have a success at one hospital, but in the very next hospital in the same system, I run into challenges with the scaling of that education.
So if clinicians we do fight and advocate and get the right training, and I do think there's been interesting movements among that and some really interesting innovations to help upskill clinicians, what do tech companies need to do for their technology to work? So clinicians do their part, but what is it from your experience the tech companies should be also thinking and doing to make it easier?
So one of the things I think that we've run into as a corollary of kind of our, just the information society is information overload. And this is a really critical issue. It used to be that you could carry around a little, what we would call a peripheral brain or a pocket helper in your pocket or in your lab coat. And you could look up and you could reference things, and that was the extent of not necessarily your needs. You always had textbooks and libraries you could go to, but it was a fairly mobile solution. And I'm sure clinicians still carry those. But one difference is in the last 30 years, the rate at which scientific or medical literature is coming out is simply overwhelming for an individual clinician to follow. So there's multiple mechanisms to sort of increase clinician awareness and education. But one of the things technology companies can do is try to make that education, try to make that information available at the point of care. So the right information at the right time to the right person and on demand. That's a huge challenge. That's a big challenge for everyone, but it's a vision that vendors and technology companies have had and that I support, which is how do we make clinical decision support painless? How do we make that non-invasive, but how do we make it helpful? So that's, so the clinician isn't having to memorize tens of thousands of things every week, which is going to be impossible. So we have to help them filter through the information overload and do that intelligently and accurately. And that's a big, long challenge. So I think that's one area. I think the other area extends into where technology and vendors, can help, will be, continuing to make that workflow simpler, more intuitive, and more invisible. Like, in other words, make the technology less the issue, make the technology somewhat invisible, and make the patient and the relationship and the actual healthcare the thing that is critical. And right now, technology is becoming a little bit less visible, but it sits between the patient and the physician, and we don't want it in the middle. We don't want it to be the relationship. We just want it to support the relationship.
I like that. Yeah, today tech sits between the clinician and the patient, and actually should be completely enabler, seamless and invisible, like you say. Patient empowerment is another key message of the findings of the Clinician of the Future report by Elsevier Health. It talks to the fact that clinicians do believe patients will be more empowered, which I think they growingly are. They'll take more ownership of their health. They will collaborate in the decision-making around their health, and technology will be an enabler of that. But I think, Tate, the things you just said, I like so spot on. There's a gap here still in design, in user experience, and in how data transfers across from the patient to the clinician to be really targeted and useful. And that's, again, some of the findings from the report really that struck out to me was, we get it, it's coming, you see the benefit, we really do, but how we, help us get there. Help us make this really synthesizable, easy, and targetable. So from a final words perspective, before I wrap up, what for you are the next steps or call to actions, I suppose, from the Future of the Clinician report? What's kind of the conversations that you're hearing, and what are you thinking?
Yeah, I think it's going to take a dialogue that is occurring, but we're going to have to keep pressure on different aspects of sort of healthcare. I guess what stands out to me in the report is that there is no one place to go to solve some of these frustrations or some of the issues that are emerging. In other words, it'll be medical education. It may be undergraduate education. It may go from there all the way through to established practice and overhauling, or at least adding or augmenting focus of traditional medical education or continuing education to have some emphasis on not just technology for technology's sake, but technology in a meaningful sense that allows physicians or nurses or other practitioners to have some meaningful update, to have some meaningful education along their journey. But I do think that it's going to take dialogues like this, reports like this, to cause interdisciplinary conversations to occur as well. In other words, technology companies partnering with medical schools or undergraduate, all the way to public health and clinical practice. So I think it's multifactorial. I think we want to start with, or we are heavily focusing in clinical decision support and making that experience more seamless, making that experience ensuring accuracy and trust in those kinds of offerings. And I firmly believe that we'll have to assist, or we have a role to play in sort of improving the relationship of the patient and the caregiver through kind of seamless integration. And I think we have to think hard about that. I think we have to think hard about how to do that in small ways that sort of build into a larger impact. And so I've said a lot there, but I hope that sort of gets at the spirit of your question.
Oh, it certainly does. And you're right, it's multifaceted. Collaboration and partnership are key, and there's a lot of things to do. So thank you so much, Tate. It's gone so quick, as it always does. There was lots packed, we had lots of insights from the report that we shared. I urge everybody to go read the Clinician of the Future report by Elsevier Health. We'll be sharing the link with you. So it's got so much content in there that do engage with it. In terms of Reach Live, we're here every last Friday of the month. Please subscribe to Reach across channels on YouTube, on Twitter, on LinkedIn. And they're always doing events. So Reach will be very soon doing an event with Middlesex and Mercer Counties Medical Society on leadership in medicine, empowering physicians to help them improve healthcare. There'll be a number of keynote speakers there, as well as the best-selling book, Growing Physician Leaders author. So if you're interested in that event, which is taking place at the end of April, drop us a line on Reach and we will send you the details. Engage with us, subscribe with us, and go check out the Future of the Clinician report by Elsevier. My name is Reena Sooch. Thank you so much for being with us, and a huge thank you to Tate for his insights and time today. Have a great rest of your Friday. See you soon.